My name is Jamie Murdoch, and I did a research project on registered nurses and how they can affect the patient advocacy process. And first, I'm going to get started, and we're going to discuss what is a patient advocate. A patient advocate is someone who serves as a mediator between the patient and other members of the healthcare team. Other members of the healthcare team can include physicians, patient family members, occupational therapists, pharmacy, other support staff, etc. They also help patients reach their healthcare goals and their desired outcomes. A patient advocate helps patients understand important healthcare decisions, all while producing positive consequences for the patient and the registered nurse. The patient advocate must also take the appropriate actions that they feel that a situation might be incompetent, unethical, or illegal by other members of the healthcare team or the healthcare system. So if they notice someone else acting in an unethical way or doing something illegal, then they need to be able to appropriately speak up and defend the patient, because the patient sometimes is not aware of those unethical or illegal situations. And patients need to have those positive advocates, such as the nurse, to be able to reach their healthcare goals in the long run. And the primary role for the registered nurse is to serve as a patient advocate. A registered nurse is responsible for a wide variety of tasks and responsibilities, but with all these responsibilities also comes accountability, and sometimes accountability can also bring up ethical issues. Being the advocate is challenging, it's rewarding. They spend most of their time at the bedside with the patient, and they must be able to report necessary changes about the patient to other members of the healthcare team. That way the patient is receiving the proper care. Successfully advocating produces positive consequences for both the registered nurse and for the patient. Both the registered nurse and the patient are affected by these consequences. Patients' rights and wishes are safeguarded, patients receive the care they desire in a timely manner, and patients get correct treatments if the registered nurse advocates appropriately. By acting as the advocate, the registered nurse increases their professional satisfaction, their confidence, and their self-esteem. It also will influence their personal integrity and moral principles. Registered nurses will receive support from their managers and colleagues. Teamwork will facilitate the patient advocacy process. The nurse may face ethical concerns if they overstep the advocacy boundaries. Nurses may be trying to protect the patient's dignity, and they may actually end up prolonging the dying process if the patient doesn't desire that. And in doing so, they'll be going against the patient wishes. That's why it's important for the nurse to be the advocate and do exactly as the patient wishes. The patient's wishes might go against the registered nurse's own personal beliefs and morals, and the patient's preferences can offend the nurse's social justice. So that's why it's important for there to be a well-defined advocacy process between the patient and the nurse. That way the nurse understands that these are the patient wishes and not that it's the nurse's wishes. I'm going to tell you a story about a time when I was personally involved and how I advocated for a patient and the positive outcomes that came from that. I work on a labor and delivery unit, and I checked the patient in. I took the patient back to the triage area. The patient was a minor. She was not 18, so she didn't legally have someone there to represent her and to sign consents for her. I found out that she was in a foster home, and that the foster home that she was in was not a safe foster home. She was not being treated well. I was able to take the information that she provided to me. I was able to talk to the physician. I was able to talk to the charge nurse, and I was able to get social work involved because this was a minor who was bringing new life into the world, and she felt that if she had to be sent back to the foster home with a new baby, that it was not going to be safe for either her or her new child. So I advocated for the patient. I spoke to the right people because she didn't know who to speak to. And the patient ended up being taken out of the foster home she was in and placed in a more safe foster home that was better for her needs and could benefit her and her new baby. So my research question for this project is, are registered nurses responsible for speaking up for the patient when medical practices aren't being followed properly by other healthcare team members? The participants for this study included registered nurses who had created their own personal blogs or they contributed to other blog sources. These blogs that were used included The Correctional Nurse by Lori Schunley, The American Nurse Today by Cindy Zolnick, Nurses Advocating for Patients by Deborah Wood, Values-Based Patient Advocates by Gwendolyn Klein, and Aging Gracefully by Gail Ingram. Samples of all these writings that I found that I just listed, I randomly discovered these blogs on the web. These blogs discussed in details the concerns they have for patient advocacy and ways to improve the advocacy process. These blogs were able to identify the main source of frustration from nurses and other staff members. And what the key, and me being able to find these frustrations was the key for me to be able to find the data to support the research that I needed. Nursing staff shared their frustrations that there's a lack of education on how to accurately approach other members of the team when they notice that an unethical or illegal concern arises. They don't feel like they are equipped with the proper ways to discuss with other members without offending them or without crossing their own boundaries. Being an advocate for the patient is beneficial for the team and the organization's culture of safety. The data was analyzed by the number of times a certain issue was brought up in the blog sources. The data that was gathered showed how being the patient advocate can benefit the patient and the nurse caring for the patient. All 5 participants in the study were female with 10 plus years of experience at the patient bedside. These participants have different healthcare backgrounds, from working in a correctional facility to a hospital setting. All 5 of the participants shared the same beliefs that the primary goal of the registered nurse is to effectively advocate for the patient. Nurses should plan to provide high quality and safe patient-centered care. Nurses should be able to facilitate difficult decision-making processes for patients and for families. The establishment of a culture of safety is key to any organization. The culture of safety can define the actions the staff should take when they feel another staff member isn't advocating for the patient in a proper way. And what they mean by this, that is, if an organization has a culture of safety in place, meaning that they have clear, defined, written guidelines showing how to approach or how to approach another team member, or how they can effectively put the patient first and be able to point out to other members of the team that they are not acting in the most ethical way. All staff should be equipped with proper skills on how to speak up for the patient when they notice the patient isn't being treated properly. A culture of safety can improve overall health care and reduce the number of errors. I found 7 different ways that were identified when the patient advocacy process is broken. The first one is that the registered nurse breaks common rules, such as they don't check the patient armband prior to administering medication. The second way is that RNs don't ask for help when they need it. They have a sense of pride where they don't want to ask for help because they feel like that other people would think that they can't get their work done. They don't have the support they need from other team members when they have questions. They don't feel like they can ask somebody a question without them thinking that they don't know how to do their job properly. They don't notice incompetent team members, they notice that there's incompetent team members, but they don't speak up to call them out that they are acting inappropriate. There's poor teamwork that doesn't allow others to feel like they can ask questions. Since there's not a sense of team, they don't feel like they can ask other members of the team questions that can help them. There's a level of disrespect between team members. There's team members that think that they may be more qualified or better at the job, therefore thinking that other people are not carrying out the process effectively. Also, micromanagement gets in the way of not being able to successfully advocate for the patient. There's always someone trying to tell someone how to do their job, even though the registered nurse is fully aware how to do her job. Others might feel that if they micromanage, they could do it better. So from my research, I learned that being a patient advocate can mean many different things. It means that you speak up for other members of the healthcare team when you notice that they aren't ethically following the correct practice. It means that you follow and respect the patient wishes if it means going against your own moral beliefs and values. Being an advocate can mean interpreting medical jargon for the patient when they are unable to understand what is being communicated to them by the physicians and helping them make responsible medical decisions that align with their own moral beliefs. I learned that nurses have so many different roles, but being the advocate is the number one and their top priority. The limitations that I face in this research project is that there is so much data on being a patient advocate and what is right and what is not right, and there's just so many little twists and turns, so it was kind of hard to narrow everything down to find exactly what I was looking for. But from the research, I feel that if organizations have an established culture of safety, and if they educate their team members, then the team members can effectively communicate with other staff members, especially when something comes up that seems unethical or illegal, and they can approach those other members of the team, and that way the patient gets what they deserve and they act as the best advocate that they can.